My name is Bill Paterson. I grew up mostly in the Chicago area, the suburbs of Chicago. I went to college at Davidson College in North Carolina, and then I went back to Chicago for medical school. I did my training, orthopedic surgery training down in Memphis, Tennessee, and then I did an extra year of training just in shoulders at Baylor in Dallas. During our orthopedic residency, we get a limited exposure to all areas of orthopedics, and these days most orthopedic surgeon residents are doing an extra year of training. The reason that I chose shoulder is that I really think that the complicated anatomy of the shoulder is very interesting, and that treating someone in a specific body part allows me to treat people of all ages, from young people all the way up to older people. One of the main things that happened when I was about 16, I actually ended up with a broken leg, and that was my first main experience with an orthopedic surgeon. That's what spurred my interest. During medical school, I thought about going into all sorts of different specialties, but it always kept coming back to orthopedics. I think one of the things I really like about it is you can really make a direct impact in the quality of someone's life and really builds a great relationship with your patients. One of the most rewarding parts for me is seeing someone who might have been in pain for years and years and years, has tried all sorts of different things which haven't really helped all that long, and then we're able to do something, whether it's surgery or not, that helps them and it really makes a big difference in their quality of life. Probably the most unique thing that I do is something called a reverse shoulder replacement, which is something that is a relatively new technology. Not a lot of people are doing it quite yet. However, it's something I did quite a lot of in my fellowship training. The other more unique things that I do are treat people with very complicated shoulder problems, such as people who might have had surgery before that didn't work out so well. One of the benefits of being in OrthoArizona and our practice is that we do have specialists, so that if I see someone who may have a fairly complicated problem that's beyond my level of training, I can definitely get you pointed in the right direction to someone who sees that type of problem all the time. Typically what I would say, if it's something that's been going on for a long period of time, maybe a couple of months, maybe you've tried some Tylenol or Advil or something else over the counter that hasn't really helped, at that point, it's probably a good idea to go see one and get it checked out and make sure that it's not anything severe.